Hello everyone. Uh, I'm glad to inform you all that we are coming up with the second workshop on bicortical implants or basal implants on 2nd, 3rd and 4th of April 2021. So the workshop will be, all the 3 days will be there. It's on Friday, Saturday and Sunday. It starts at 10 a.m. in the morning and it will go till 5 o'clock in the evening. You will have 2 breaks at 11 o'clock and also 2 o'clock for the snacks and the lunch. So in the first day there will be lectures and hands-on, and there will be live surgery case will be there. A live surgery case will be a full mouth rehabilitation case where we make our sinus floor, pterygoid area, maxillary sinus, as well as we will teach you how to place implants in the posterior mandible. We will teach you the bypass technique, narrow bypass techniques, and how to manage the maxillary sinus during the atrophic maxilla. So how to manage the maxillary sinus, how to bypass the maxillary sinus, all these things will be taught, and also how to place, how to select the length and diameter of the implant in the anterior maximal, where we are going to place the implant in the sinus floor. So we are going to rupture the sinus floor and place the implants. So you will get the maximum stability and anchorage in the maxillary anterior region, and in the molar region usually there will be a cancellous bone. It will be very dense, and you may not get enormous amount of the cortical bone in the maxillary area. So usually we will place the compressive implants in the maxillary molar area. So we place the vampire implants in the pterygoid plates, pterygoid process, and we take the maximum support in full mouth rehabilitation cases from the pterygoid process. Okay, in the same way in the lower anteriors, so we place usually 6 to 8 implants in the anterior region till the first premolar area, and later on in the posterior mandible we place compressive implants. So in full mouth rehabilitation cases, usually in the upper we'll place 8 to 10 implants. Usually the 10 implants will place, as well as in the lower mandible we place around 8 implants. So totally some 18 to 20 implants we are going to place in full mouth rehabilitation cases. So after the placement of the implant, that is the live surgery, it will happen on the first day of the workshop. So usually we'll complete the surgery in the first day of the workshop. So we will ask the participants, and we will allow the participants to place the implants on the patient. So if they have any doubts, they can clarify on that day itself, and they can ask all questions, and we are eager to help you out in whatever the way. We will try to clear all your doubts on the same day. So later on in the second day there will be theory class will be there. Also the hands-on will be there. So next the case discussion will be there. On the last day of our workshop, we are going to give prosthesis for the patient. On the third day and Sunday, we are going to do prosthesis for the patient, and there will be case discussion on that day about the pros and cons, and as well as we may discuss in length about the prognosis of the treatment, and comparing this basal implants with the other type of conventional treatment. What are the advantages, disadvantages, all this we are going to discuss. So later on at the end of the workshop, we are going to give or distribute the certificates for participation. That is, we will give the certificates to all the participants on the last day of the workshop. That will conclude our workshop on the third day, that is on Sunday. So I invite all the doctors, so please call us on our numbers. So that is 9738369221. You can call me. I am Dr. Venkatesh or Mr. Vinay Mishra. So you can register yourself. So most of the doctors may be practicing conventional implants. You don't know, the situation may arise where you cannot place the conventional type of implants, that is atrophic maxilla or the flat mandible, where the no bone situation arise. So in such cases you cannot place the conventional implants. So in such cases basal implants really holds good. It's not only about the full mouth cases. You can place the basal implants in the partially edentulous areas also, in the mandible or maxilla. So when are the one single tooth or 2 teeth missing, you can place the basal implants. So, and also the main thing with the basal implant is that, so the treatment period will be less and the patient will be comfortable, since you are not going to use any graft, or you are not going to give any incision, you are not going to raise any flap, or you are not going to do any suturing. Patient will be really at comfort, and the patient, the functioning after the processes is given to the patient, he will start eating on the processes the next day itself. So it will be comfortable to the patient also, and the treatment period will be less, and the patient will feel happy about the treatment. So I welcome you all for our second bicortical implant workshop on 2nd, 3rd and 4th of April 2021 at my clinic premises in Bangalore. So the website as well as my clinic address and the posters will be displayed on Instagram, it's on the Facebook, and also on the WhatsApp. We'll distribute all those things. Those who are interested, please take the initiative, register yourself, and please do attend our second workshop on cortical implants. Thank you so much.